Hello, everyone, and thank you for attending today's webinar on the patient RCM powered by ClearGage. We're really excited to share this one. It's a big win in terms of payment process. So please, as usual, for our Wednesday webinars, put your questions within the Q&A field in Zoom, and we will answer them after. This will also be posted on the usual Wednesday webinar website right after this presentation. Today's a short one, so enjoy some time back in your day. It's about 15 to 20 minutes, and I hope you enjoy. Again, any questions that you have, please feel free to put in the Q&A field, and we'll send out answers afterwards.
Hello, and thank you for joining us today. Today we want to cover some tools that can help you with a very significant problem happening today in most medical practices across the country. And that problem being collecting from your patients. As the patient has become the largest payer group out of all payer groups, it has become ever more frustrating to collect what is owed to you by those patients. With Patient RCM powered by ClearGage, we're going to give you some tools that you'll have access to work with those patients where they're at, which is a great thing. People are looking for options. They're looking for ways to be ways to pay their bill, if you will. So that's what we're going to talk to you a little bit about today. We're going to start off with covering the unique solutions to those patient balances. First, we're going to talk about auto pay with account on file. That is an automatic draft for patients who have after insurance balances. We're going to talk to you about mobile quick pay and AR payment plans. Mobile quick pay is an automatic communication tool that allows patients to click a link and then either set up a payment plan or pay a bill directly through that link from their phone or from their computer. And then we're going to talk to you about a new way to do point of service payments that does not require a credit card swipe. Exciting, I know. The next thing, we're going to talk about patient consent to telecommunications outreach. We're going to touch on that briefly. It is necessary in just about every instance that we'll talk about today, as well as how these payments that you are getting from these patients are actually going to be posted back into QPN automatically, which is exciting. So without further ado, here we go. First off, let's talk about auto pay with account on file. So what is auto pay? Well, it's used for those small balances that move to patient responsibility after the insurance claim is paid. Typically, those balances will fall into a statement cycle, or you got to wait until the patient comes back in, ask them to pay their balance. When they return to the clinic, they give you that deer in the headlights look. Can I pay you later? I can only pay $5. With account on file, you are going to get their credit card. You're going to store it. There's going to be a time delimit on the agreement. There's going to be a number of uses limit on the agreement, as well as the dollar amount that's all set up by the patient. Makes it very, very simple. When they have a balance that comes in, they are billed automatically. And we're going to go into that a little bit right now. Oh, one of the most important things is that it's going to decrease your statement cost. Why? Because you don't have to send a statement for those small, typically uncollectible balances, of $150 or less. If you have this account on file, it's going to happen automatically. It's also going to happen within 2 to 3 days of it being assigned to the patient responsibility, so you don't have to wait for an entire dunning cycle to get your money. As I mentioned, it's perfect for new and pending balances. It's also perfect for low balance collections. The patient does receive a notification via text or email before their account is debited. We try to talk to patients before we take money for them and give them options if for some reason they need to change their card or cancel that payment. I definitely don't want to cause anybody any distress over making their payment automatically. And also, this is perfect for collecting on balances that are typically too small to invoice, as I mentioned earlier. Again, patients can also view the invoices online through the portal. But remember, the biggest advantage to auto pay with account on file is that it will automatically bill the patient as soon as the insurance adjudicates the claim. You don't have to wait for that statement cycle. This is how it works within QPM. This is a screenshot of the GlowStream patient portal. On the left, you see a menu item called Account on File, and the patient simply clicks from the convenience of the portal, they simply click on account on file. They're going to fill in the maximum amount that they authorize, the number of payment events, the length of their agreement, as well as their method of payment. And then from that point forward, they're going to see all of this information back into QPM. You'll notice that the account authorization status is active and green. The authorized duration of agreement in months is 6. That there is a maximum pre-authorized amount of $75, and that you can use this up to 6 times within that 6-month period of time. Very simple. Not only can this be done by the patient through the portal, but it can also be done by your staff whenever they're sitting there talking to a patient. Maybe a patient's checking out, they had some lab work done, and you know that they're going to have a balance after the insurance adjudicates. Very simple for your staff to simply click on the account on file button, and then basically do the same thing that the patient does. You fill in the maximum pre-authorized amount, the number of events, as well as the duration in months. Make sure that you don't forget to fill in a primary payment method. If they have previously used a debit or credit card at your office, you will see that information pre-populate. You can ask them which one they would like to use. Maybe they have, you see on the screen, a Visa credit ending in 1111. Maybe they also have a MasterCard or an Amex ending in 2345. They also have the capability of using their bank account or savings account or HSA or FSA card. And all of that can be stored within the system. No need to scan it or type it in, anything like that. Again, all of this information is completely embedded in the practice workflow within QPM and requires very little effort from your office staff. Moving right along, you'll see here that this is another screen on the account on file, letting you know about all the relevant information, that it is active, and the duration, etc. So I mentioned that we talk to patients before we debit any amount from them. This is actually an example of what they will see either via email or text message that lets them know that, hey, you got a balance and you have an agreement. And according to your agreement, we're going to go ahead and bill you for this balance. In this example, $65 using the card ending in 1111. Here's when it's going to be processed. And if you've got a question or a problem, here's the number that you need to call. All of this, of course, is tailored directly to your practice, and that is all done by Triarq and ClearGage behind the scenes. Nothing is needed from your staff as far as setting any of this up. All right, so let's move forward to the next thing. Mobile Quick Pay and AR payment plans. Mobile Quick Pay, what is that? Well, it's exactly what it sounds like. It is a mobile tool that allows patients to pay quickly by using a link. An AR payment plan, that's pretty self-explanatory, but many times, in many cases with many softwares, you don't have a way to effectively manage payment plans that are set up by patients. Sometimes they are open-ended with an automatic draft every month, and you have to monitor that and cancel it once that balance gets to zero, or it doesn't give the patient any options as far as terms or the date that the payment comes out on. All of that is actually built into the patient AR or patient RCM powered by ClearGage tool. So you will have access to all of that, and it's very, very simple to work with your patients on. So let's talk about small balances first. For patients who decline to provide a credit card on file, you can still have a mobile Quick Pay and what we call Quick Pay Lite to send them text or emails that contain a link where they can make a simple one-time payment using any internet-connected device. It's a huge advantage because it lets you communicate a balance to the patient as soon as insurance adjudicates the claim, and it becomes patient responsibility. That's a biggie. You don't have to wait for the next patient statement cycle, as we said many times, and you get to avoid that, so it saves you time. You don't have the diminishing return on your statements. You don't have to try to collect from the patient. It puts it all back into their hands. with just a few clicks. It's great for collecting small balances. Maybe you've got a patient with an $80 balance. They call you. They're like, I'd really like to pay this. Great, no problem. You simply click a button. It sends them a link. They click the link, takes them to a portal. They make a payment, and they're done. Comes right back into QPM, posts directly to their account, and all you had to do was hit a button. It's very, very simple, very efficient. So how easy is it for a patient to make that payment? Well, first, once you click that button, or if it runs overnight, because there is a nightly file transfer, get into that here a little bit in just a minute. This is what the patient sees. They're going to get an email that's going to let them know, hey, you got a balance. See, this one is $35.67. Pretty common in most small practices these days. Balances are left over after insurance. Patients maybe met their deductible, or maybe it's just a part of their co-insurance that was required on a treatment that they came in and had done. All they have to do is click the button that says View Payment Options, and then they will get a screen that looks very similar to this. Hey, you got a balance due. Thanks for clicking here. If you pay this today in full, we're going to give you a balance. I'm sorry, a balance. We're going to give you a discount. We've already given you a balance, but we are going to give you a discount. That discount is actually 100% customizable by you, does not have to be given, but if you would like to give a prompt pay discount, you are more than welcome to. During setup, if that's something that you would desire, you would speak with Triarq staff or with ClearGage staff, and we would make sure that we built that into the system. The patient then just clicks the Pay Now button that you see. If this were a much larger balance, they wanted to move to a payment plan option, if you look at the bottom of that particular screenshot, it does say View Payment Options. Then they would be given options to set up a payment plan through this exact same interface. So once they've decided that, yes, they want to pay this $33.88 today, they go ahead and click Pay Now. It's going to take them to an area where they can enter their credit or debit card, checking or savings account, again, HSA or FSA. If they already have used this, or they have payment options stored within your system from coming into the clinic, they would actually see those here, and they simply click on one, and it will use that particular payment method. If they have not, or they need to change it, you can see that they have the option here to do so. So once they've got that information entered and they click the Submit button, they do receive an acknowledgement of payment, lets them know that it was successful, that a copy of the receipt was emailed to the email that we have on file, but they also have the option to download or print the receipt. They can do that while they're walking to their car from their office on their lunch hour and have it done before they ever make it to the parking lot. Well, what about those big, huge balances? Not every balance is a sub $150. Sometimes you have these patients that, maybe they had a serious episode or came in for several different treatments, or maybe they have ongoing, things that they come in for, lab work or PT, those kinds of options or treatments. They tend to rack up balances fairly quickly, and sometimes those go months without being paid, if ever. How do you work with those patients? Well, we also have what is another facet of mobile quick pay, and what we do every night is we actually generate a file of outstanding balances, over a certain amount and over a certain time limit, and we download that file into the ClearGage system. We scrub that file. We look for account on file with autopay or autopay with account on file agreements. If those exist, we trigger those, trigger that event, send that out to the patient. We bill them. If they don't have one of those in place, we actually send the patient a text and an email asking them for consent to talk to them. Once we've gotten that consent, then we send them to a portal very similar to what I just showed you. You'll see the screenshots on the screen look very familiar from the slide that you just saw, but these are for much larger balances. From here, they're going to have options to set up a payment plan. Of course, they can still make a one-time payment. Maybe they had just got an inheritance and they want to pay that $1,000. We love those patients. They can do that simply by clicking the Pay Now button that's on the screen. But most people can't do that. So for those people, they can click the View Plans link at the bottom of that first screenshot, and it will take them to the second screenshot where it gives them multiple payment options. They can, based on parameters set ahead of time by your practice, they can either choose to pay it off faster, or they can pay it a little bit less per month and make it a longer term plan. If for some reason the plans that are presented to them are not favorable to their financial situation, they can actually propose a plan that will notify you that they've done so, and you can review that before choosing to accept it or deny it. So your patients have a lot of power, but it also is a lot of convenience for you and your staff, because you're putting everything back into the patient's lap and letting them set this up on their own. So again, as I've mentioned, patients can choose from pre-approved plans that are set up ahead of time. They're also specific to your practice. If you want, certain balances, say from $20 to $100 to be, how many plans are shown to the patient and for how long, but maybe you want those patients that have $1,500 to $2,000 balance, you want them to see more plans with a longer term, because it's going to be more favorable to them, and we don't want to alienate them and make them feel like we're pressuring them to pay the whole thing off in 2 months, although that would be nice, but we know that typically cannot happen. The patient can, from this portal, specify the date each month that they want that payment to come out on. They can also go in and change it if they need to. They can specify the account, the credit card, the checking account, whatever they need to pay that from, very similar to what I showed you before. And again, once they make the payment or set up the plan, they will have the opportunity to download the agreement as well as download the receipt. Again, you can use an HSA or FSA card. Most HSA cards are backed by Visa or MasterCard. It's no different than a debit or credit card. They can definitely use that. Many of you don't take ACH payments or payments from a bank account. We will give you that option. So a patient, maybe they don't want to leave you a credit card, or you have people out there still don't use them. In some cases, that's great. All they have to do is give you their account number and their routing number for their bank or checking account, and they can use that as well. This is an example of the email that a patient would receive after that file download that we get, and then we process the file and look for balances that are patient responsibility, and we're going to send out a text or email. And this is an example of what they get. Now, obviously, yours won't have client logo here on it. It will have the logo for your practice. It is customizable. That's all done during setup. So it's great and very easy. They'll know exactly where it comes from. We do encourage you to let your patients know about a week or so before everything kicks off that they're going to be receiving these texts and emails. In today's, in this day and age, people get so much spam, so many robocalls and everything else. I don't know about you, but for me, I have more blocked numbers on my phone than I actually have phone numbers for contacts because of all the robocalls. So we think that, it's very important that you let these patients know, hey, you're going to be receiving these texts and emails. They are not spam. Please do not delete them. Please click on the link. And we give you about a week ramp-up time for you to do that. We encourage you to communicate with them through Facebook, any other social media that you use, your portal, hand them there are some handouts that we provide to you that explain the payment policy, the account on file, the quick pay emails and texts as well, so you can give those out to your patients. Anything that we can do to help you be successful in this journey. But when a patient receives this email, they simply click the View Details link right there in the middle, and it will take them to one of two places. If they have given consent for text and email, then it will take them directly to the portal, and then they can set up a payment plan, make a payment, whatever they need to do. If they have not given consent, it will actually take them to a consent webpage where they basically read the terms and conditions, give their consent to either text and or email, or deny consent, and then sign it. And once they do that, it will then take them to the portal. And I'll go over the consents a little bit later, but the consent is very, very important in this whole journey. Here's an example of what the balance campaign journey kind of looks like. I've mentioned consent a lot, and for those patients that we don't have consent on the left-hand side, on the patient consent campaign, there are 4 tries, if you will, that we use to attempt to contact those patients. If they ignore those texts and emails, or they delete them, or they reply stop to the text message, or they unsubscribe from the email, we're going to try and do that. Give them 4 options to verify and contact, or give us permission to contact them. And if they don't, then we're going to move them into just the standard statement campaign. Now, if they do that for some reason, they weren't paying attention, they deleted it, you do have the option of actually putting them back into the quick pay journey, and getting them back on the roadmap of being able to pay through the portal. And there's a simple button that you use that will resend them a link, if you will, or you can send them the consent form for whatever reason if they come in and talk to you about it. If they do acknowledge the email and text, on the right-hand side, you see the standard balance due campaign. Over a period of 55 to 60 days, we're going to send them emails and texts that let them know, hey, you got a balance. We'd really like you to pay it. Here's an easy way to do it. Click this link. If they go ahead and click the link, they make the payment, or they set up a payment plan, then they actually will fall out of this notification, because all of that will happen and be happening all automatically. There's no need to tell them about it because they've already agreed to it. But what if they come back in and they get a new balance? Well, guess what? They jump right back into the standard balance campaign. We're going to email them based on their consents. We're going to send them texts, and we're going to get them to try and deal with that new balance. So it's an ongoing journey, if you will, and that's one of the reasons we call it a campaign journey, because this is a campaign to get them to pay. It is a journey that we walk them through. And they keep going in that as long as they have those balances that either keep coming up or haven't been paid off. So let's talk about point of service payments real quick. Point of service payments, we all do them. Typically, you've got a credit card swiper, or you've got a Square. You're playing, merchant rates. Sometimes your rates are high, sometimes they're low. You may think you have low rates, and then you look at your fees, and you're paying $8,000 a month in fees, which is just catastrophic for your practice. But we want to make things easy for you on the point of service side. With the swiper, sometimes it can be inconvenient. The swipers don't work. Patient forgot their card. Any other number of reasons. So within QPM, what we've done is we have a direct interface that is powered by a ClearGage as well, and you have the opportunity to do a one-time payment directly from the QPM dashboard, if you will. You don't need a credit card machine. Certain fields will actually auto-populate, such as the patient demographic. If the patient has not used the card before, you simply enter their card number. As you see on the right, if they have used the card before, it should be filled in. You can drop down the payment method drop down you see on your screen, and choose a different card, or, as I've mentioned many times, a banking account or checking account. So they have multiple options. If they want to enter a new card, maybe this one's declined now, or it's no longer good, the date changed, they can do that from this screen as well. It's very, very quick. And you have the option to choose different types of payments, as well as an amount that you would need to fill in. The patient's first and last name, their ID number, all of that is pre-populated. You also have the ability to leave notes if you would like to for this particular transaction. It's great for copays. It's great for people coming in making a payment on a bill. Maybe they're buying something you sell in your office, some sort of cream or supplement or something. You can do all of that through here as well. Patients will get an acknowledgement. They do have the opportunity to sign. If you have a signature pad, they can use that. If not, the easiest way to do it is just turn it and let them use a mouse. Or if they're standing in front of you, ask them if it's okay if you sign for them. You use the mouse and you give them that little signature. You can print the receipt, or you can send them an email receipt directly from the interface that's on your screen. And on the left-hand side, I want you to pay attention to the button top right, but the far left, it says account on file. Well, guess what? From this screen, you can also click that button and then set an account on file up for that patient, so maybe they don't have to come in and make these payments. Very, very convenient, very easy, very simple. So after you close the form, everything gets sent back to the QPM environment. It goes in seamlessly. You'll notice that the payment has been made, that the information that you entered is directly on the screen, outlined in red, and all you had to do was type in the amount and choose the appropriate card and then click submit. Very, very simple, seamless, very easy. Takes very little time. Should save you a lot of time at the front desk with your staff, busy trying to check people in and check people out. All right, patient consent. We're getting close to the end of this thing. Thanks for staying with me to this far. I do want to talk a little bit about patient consent. I've mentioned it numerous times throughout this webinar. It is a bit of a big deal. You probably already have some sort of consent if you're using any type of patient portal, or maybe you're sending text and emails, appointment reminders, whatnot. You've gotten consent from your patients. That's fantastic, and we applaud you for that. However, we also need consent to communicate with them, so they will get that consent again. Typically, when they are sent an email or text for the very first time based on a balance that they have with us, they will be given an opportunity to give consent. It's important that you let your patients know that that's going to be happening. If you can integrate our consents into yours, that's even better. But you will notice on the screen that there is a link there at the bottom of this screenshot. This is patient consent. Click here to register, modify patient consent. You have patients that will get the emails and text. They click the link. They're not paying attention. They'll say no to text message, yes to email. Then they come into your office 2 weeks later and they're like, you know what? I've been getting these emails. I'd really rather have a text. How do you change that? Well, they can go into the portal and change it. But one of the things that is easiest for you is to click the link at the bottom, and then you have the opportunity to change those consents for the patients. Very, very simple. It actually pops up in an iframe within the QPM environment, and it will on the right-hand side, bottom right-hand side of the screenshot, you'll see that the email is yes, e-sign is yes, SMS is no. If you went ahead and made the SMS yes, then that would populate green, and you would be able to see that yes, they've given you consent for that. I clicked forward a little bit quick, but this is a screen shot of what the consent form looks like for the patients. Now this is all digital, but this is what the text of it looks like. The email address that you see on the right-hand side, kind of in the middle, as well as at the top, it says my cell phone number is. If those are in the patient demographics within QPM, those will actually pre-populate. So you won't have to fill anything out for the patient. They won't have to fill anything out. They simply say yes or no to a couple of different areas and then sign at the bottom. It's very, very quick and very easy. So what about all these payments that you're taking? What happens to them? Do you have to go and sit, find them all, and then allocate them? Make sure they're posted to the right account? No, you don't. It actually will all post back to the QPM environment and database to that patient's account automatically. If they make a payment with a one-time payment option standing in your office, it's posted to the account automatically. If they come in and or if you send them a link and they do the one-time payment through the portal, it's posted to their account automatically. If they set up a payment plan through the portal and they make a payment on that payment plan, it's posted to the account automatically. There's nothing that you have to do. Very, very simple. You'll notice here as I scroll through the screenshots within QPM that you have several transactions that are ready to post. You click post and they automatically go right in. Very simple. You do have the option for manual distribution. It is default to auto distribution, but maybe you're like, yeah, I really want a little bit more control over this. Not a problem. Set it to manual distribution. You have to go in and post them, but you'll have more control over how much, where, to what line item, those kinds of things that may be of concern to you in your practice. Bottom line is you have a ton of control over how these get posted, but as far as posting goes, there's really nothing for you to do other than click a button. So that's my story. I'm sticking to it. I hope you've enjoyed this webinar. If you are interested in using patient RCM powered by ClearGage, and I hope that you are, please reach out to Patrick Murphy. You will see his email address on the screen, pmurphy@triarqhealth.com, or you can contact him by phone, 734-776-4799. If you have any questions, you will have you've had opportunity during this webinar to leave those questions. We'll do our best to get them answered as quickly as possible and get them back to you. But I do hope to speak to and see you, many of you coming up in the future, because you've decided to move forward with this. Thank you for your time, and I hope you have a wonderful day.